Hello, everyone. Welcome back. Now, we've just crossed into a new level with the numbers of the coronavirus. We are now at 1,273 total cases. Now, this thing is just burning through the country like wildfire. Like, it's just burning through. Now, I'm not trying to scare anybody. I'm not trying to make people panic or anything like that. I'm just trying to inform you and trying to analyze some things that most people probably aren't really looking at and that you may not be really seeing in the news these days. Now, we have 40 deaths, and you have to understand that this really means 40 deaths in the hospital. That's exactly what it means. It doesn't mean total number of deaths from the coronavirus. Obviously, it doesn't take a rocket scientist to understand that there are probably a whole lot of people that might have died from this thing outside the hospital. Some people might have died from it and they would just think it's something else. They would think probably even spiritual attack. Understand? So it's only those people who were diagnosed as coronavirus patients and were in the hospital. And out of those people, those that died, that's where you're getting these 40 deaths from. It's still pretty high. It's very, very high. But I just wanted to put it in perspective for you to understand that this thing is beyond what you are seeing in the numbers. So if you're seeing 1,273 in the news and you're scared, know that we are probably 10 times, 20 times, maybe even 100 times more than that already. Because this thing spreads like crazy. It spreads like crazy. You have to understand that the number of cases we can detect can never be above the number of tests we have carried out. Like right now, I still don't think we have carried out beyond 8,000 tests. So it means even if every single cases we tested came out positive, we would what? We would have beyond, we can't have beyond 8,000 positive cases. And that gives the lie to this conspiracy theory flying all around that if you go to the hospital, or maybe you are being tested, you are always going to get tested. That is, you are always going to get tested positive. Like you are going to be positive. If that is the case, we have done thousands of cases, thousands of tests, and we have just 1,273 cases right now. That means not every single test leads to a positive. So all those crazy conspiracy theories have to be put aside and let us be very serious about this thing. And all those people spreading conspiracy theories around have to be very careful because they are putting the lives of people in danger. They are jeopardizing the lives of people. A whole lot of people now are not going to go for tests even when they need it. They won't go for tests and they won't go for treatments now when they need it because of crazy people like that. Now they have the right to their own speech and whatever, but they don't have the right to put people in danger. That is the problem. Again, you have to understand that even if you have this thing, there is a great chance that you will recover. We have 239 people discharged now, fully recovered. And a whole lot more people are still going to recover. Again, there's one very big problem with Nigeria and our recording and our statistics. They don't give us the breakdown of the demographics of people that are dying, the breakdown of the demographics of the people that are contracting this thing. For example, now we have 40 deaths. We don't even know the age range of those people that are dying. From outside the country, they will give us all those things. We will understand what happened. We understand the age range. We understand so many things like that. We understand that 90% of people are extremely old people that die from this thing. Like in New York, the number of people that died from this thing, from the age range of about 24 to about 50 years old, they are just about 23 at the end of last week. Out of how many deaths in New York? Out of thousands upon thousands of deaths. 23 people in a very wide range of age. But because they are younger and probably not going to have enough pre-existing condition that would make them to be susceptible to the chronic cases of the coronavirus. So that's the issue. We don't get all those data in Nigeria. We don't get all that. And that brings me to the main thing I want to talk about today. And that's the lack of modeling. We don't have any form of modeling in Nigeria. In all those other countries, you would have things like the IHME model used by the United States and the White House to predict, okay, how many deaths are we looking at? How many people are going to get this thing? How many people are likely going to die from this thing? so that at least you'll be prepared. If you know the number of people that are going to get this thing, you are going to be prepared in your medical facilities, and you will be able to prepare for them without being overrun, without being overwhelmed by the number of cases that will be coming. Because honestly, I'm going to make this thing very clear to us. Sooner or later, we're going to have so many cases that hospitals may start struggling to be able to hold these cases. That's the issue. That's the very serious issue. We just have to know that. You may not be at the hotspot of Lagos right now. Wherever you are, it may get serious there too. You just have to understand that. And we cannot even remain in lockdown forever. Sooner or later, we will have to emerge from this lockdown, and people are going to reinfect each other again. So that's just the problem. So the best thing for us to know is to understand, okay, how many people are going to get this thing at this particular condition? Okay, we're all locked down. How many people will still get this thing even during this lockdown? If we are to reopen, how many people are going to get this thing? How many people might die from this thing? Considering the death rate of the thing, of the sickness. We have to know all those things in order to be able to do was to make proper policy decisions on the public level, proper public decisions, public policy decisions. That's the reason. Because if we don't even know the risk we are weighing against, how are we supposed to take the right decisions in addressing them? So we are talking about using lockdown to save lives. We don't even know how many lives we are saving. We don't know how many lives would have been lost if we didn't do any sort of lockdown. We don't know how effective the lockdown is going. We don't know. In all those other countries, they have a metric of all the things they are gaining. They have a metric of the advantages they're getting from the lockdown. So they know, okay, it is working for us because we have been able to save so amounts of lives based on the models. We don't have any sort of models like that here. In Britain, they have the Imperial College model that they follow, predicting the possible number of people that might die from this thing. So they are prepared for it. It's a very sad thing, but they are prepared for it. So it's not going to shock them when those things happen. We don't have any of such in Nigeria. We have so many universities here. I'm not trying to insult professors all around and mathematicians, but we have so many of them here. We are not coming up with any sort of models. So we need data. We need data to be able to assess our progress with the entire lockdown issue. We need to be able to know what we have been able to gain during this lockdown, how much lives we have been able to save, how much we have been able to prevent the medical facilities from being overwhelmed, how much more medical facilities we need to provide. Because if we don't have numbers on the number of people that might get infected, how are we supposed to prepare for them? That's just the problem. How are we supposed to prepare our medical facilities to be able to cope with these numbers that are because the thing is going to keep rising. At the point, people thought it was not going to be more than maybe 200 cases. We are over 1,000 cases right now, and it's going to keep increasing. Let's not kid ourselves. So if this thing is going to keep increasing, we have to understand just how much cases are we talking about? How many cases are we expecting so we can prepare for it? So the government can prepare for it so that we can have the hospitals prepared for it. Because if we don't have any sort of metric to gauge this thing, I'm telling you, we are going to end up, God forbid, but that's what is going to happen. We're going to end up at the level of Spain or Italy. That is what is going to happen. Our medical facilities, our medical sector is going to get completely overwhelmed by the cases that are going to be coming up. Because we don't even know what we are looking up to. We don't know what we are expecting. We don't understand what we are expecting. So that's the issue. We are flying blindly right now. We are basically flying blind through this entire coronavirus issue. We are just winging it. The government is just winging the issue. That's the problem. And it's very, very painful. It's very, very disappointing that we can continue doing things like this, even though we are called the giant of Africa. Among African nations, we shouldn't be one of those nations who won't be able to have solid data on what is going on in the country. The Presidential Task Force always have meetings and have all the press briefings and everything. We don't know the number of deaths we are expecting. We don't know the number of cases we are expecting. We don't know how much we have prepared for those cases. How much you have prepared for things that will come in the future, because the best way for you to prepare for something is that you have prepared for it before it comes. That's going to give you a leverage, and it's going to give you an ability to be able to withstand it when it comes. It's like waiting for a flood. The flood season, so you already start building what you start building levee, because you know the flood season is coming. You know how terrible the flood season is going to get. So you are going to be able to prepare adequately. But if you don't know how heavy the flood season is going to get, you are risking preparing, that is under preparing. You are risking yourself to be under preparing for the case. So what if it comes and it overwhelms you completely? In that sort of a case, you are going to end up, like I said, like Italy. God forbid, but that's the situation. We need to be able to make sure that we understand what is going on. We need to have clear vision. So that's what I'm just going to be saying about this. And I really hope that God really, really delivers us, and this thing ends very soon. But we need to be proactive. We need to be very serious about this thing. Our leaders need to be very serious. We need models to understand what is happening. We cannot keep flying blind. We don't have to get there. Like this mentality is very pervasive in Nigeria. When we get to the bridge, we cross it. It's a very stupid mentality. And that is what we are following right now. So we're just flying blind, waiting to get to the bridge and cross it. What if we get to the bridge and there's no bridge to cross? We get stuck. So that's the problem. We really need to fix that problem of winging issues in this country. So anyways, make sure you subscribe to the channel, like the video, and I'll be seeing you guys in the next segment.